I'm Dr. Vivian Cole, an endocrinologist specializing in male vitality, and frankly, I am absolutely stunned by what I am seeing in recent clinical data regarding something you probably have in your kitchen right now. We are trained to look for complex biochemical pathways and pharmaceutical interventions when dealing with men's health, specifically regarding performance and vitality down there. But the latest studies focusing on a very common household spice are challenging everything we thought we understood about localized cellular regeneration. And the most shocking part isn't even that it works, but that the scientific community is still debating the exact mechanism behind why it produces such a rapid response in erectile tissue. I need to be very direct with you here. If you're over 40 and have noticed a subtle decline, perhaps things aren't as firm as they used to be, or the response time is lagging, you might be assuming it's just a normal part of aging. I see this every single day. Nearly 70% of the men who walk into my clinic arrive thinking their testosterone must have plummeted, completely unaware that the real issue often lies in localized tissue degradation, not systemic hormonal collapse. By the end of this video, you're going to understand exactly what is happening at the cellular level and why this simple compound might be the missing link your doctor hasn't mentioned. The core problem we are looking at isn't simply a lack of blood flow, which is what the conventional medications focus on. Those drugs force vasodilation, essentially flooding the area with blood, but they do absolutely nothing to repair the underlying structural integrity of the smooth muscle tissue or the endothelial lining of the blood vessels themselves. When men experience a decline in performance, what is actually occurring is a slow, progressive damage to the tiny blood vessels caused by oxidative stress and low-grade inflammation. The tissue loses its elasticity. It loses its ability to respond efficiently to the signals from your brain. This is why you can have perfectly normal testosterone levels and still struggle. The infrastructure itself is compromised. For decades, the standard medical approach has been to prescribe a pill that temporarily overrides this damaged infrastructure. It's a mechanical fix for a biological problem. While it might produce a temporary result, it doesn't halt the progression of the underlying tissue damage. In fact, relying solely on forced vasodilation without addressing the structural health of the tissue can sometimes mask a worsening condition. What is emerging in recent literature, including a fascinating overview published in relation to natural compounds and endothelial function, is that certain potent antioxidants can actually intervene at the site of this oxidative damage. The real challenge is finding a delivery method that allows these compounds to reach the localized tissue without being entirely metabolized by the liver first. And this is exactly where the error lies for most men trying to fix this on their own. They assume that just eating more healthy foods will automatically repair localized vascular damage, completely underestimating the specific, concentrated intervention required to reverse years of oxidative stress in such delicate tissue. The intervention that is causing such a stir involves the topical application of specific active compounds derived from common spices, most notably those containing high concentrations of certain alkaloids and antioxidants. The research is pointing towards a phenomenon where localized transdermal application, rubbing a specific preparation directly on the skin, allows these compounds to bypass the digestive tract and act directly on the endothelial cells. The mechanism here is fascinating. We are looking at a potent upregulation of localized nitric oxide production, completely independent of the standard systemic pathways. When you apply these specific antioxidant-rich compounds directly, they seem to reduce the localized oxidative stress that inhibits the enzyme responsible for nitric oxide synthesis. By clearing out the inflammatory noise at the cellular level, the tissue's natural ability to dilate and engorge is restored. This isn't forcing blood into the area. It's healing the tissue so it can function naturally again. We are also seeing evidence of improved smooth muscle relaxation. The active compounds appear to act as natural calcium channel modulators within the localized tissue. In order for an erection to occur, the smooth muscle cells within the penile arteries must relax. If they are tight and inflamed, blood flow is restricted regardless of your arousal level. These localized applications seem to signal those muscle cells to release tension, allowing for the natural expansion necessary for optimal performance. The clinical data supporting this, while still emerging, is incredibly compelling, showing measurable improvements in arterial flexibility when these specific compounds are introduced directly to the compromised area. Furthermore, there is a protective effect on the nerves themselves. The peripheral neuropathy that often accompanies aging or mild metabolic issues can dull sensation and delay response. The intense antioxidant properties of these specific spice-derived extracts appear to offer localized neuroprotection, reducing inflammation around the nerve endings, and improving the speed and strength of the signals traveling between the tissue and the brain. If this kind of detailed, mechanism-focused medical information is helpful to you, I'd ask that you like this video and subscribe to the channel. This is the exact type of conversation I have in my clinic, and bringing this level of clinical understanding out of the office and into the open is crucial for men's health. For years, I was incredibly skeptical of anything that wasn't a standard pharmaceutical intervention or a strict dietary overhaul. I built my practice on hard clinical data and conventional protocols. The idea of using natural extracts or specific localized applications seemed, frankly, like alternative medicine noise. But the reality of clinical practice forces you to look beyond the textbook. I had a significant subset of patients, primarily men between the ages of 50 and 65, who were doing everything right: diet, exercise, stress management, but still struggling with that localized tissue responsiveness. The foundational habits weren't enough to overcome the entrenched vascular resistance in that specific area. This gap in treatment led me to dive deep into the research on targeted, concentrated natural compounds. I started analyzing formulations that utilized these specific mechanisms we've discussed, looking for something that provided the concentrated intervention these men needed. The combination I eventually began testing, and now regularly include in my clinical protocol, utilizes epimedium, which acts as a natural PDE5 inhibitor, working similarly to the synthetic medications, but without the harsh systemic side effects, supporting the localized vascular relaxation we need. It also incorporates alpha-lipoic acid, a powerful antioxidant that specifically targets the peripheral blood vessels, reducing the inflammation that physically restricts blood flow in the erectile tissue. The results in my clinic have been striking. While individual responses vary, I've consistently seen men in that 50 to 65 age bracket report a noticeable return of localized vitality and responsiveness within a 4 to 6 week window. It's not an overnight magic trick, but a consistent biological restoration of the tissue's function. This isn't a pharmaceutical drug, it's a targeted nutritional and structural support system with documented mechanisms of action. I always verify the purity and clinical backing of anything I recommend, ensuring it meets strict safety standards. I've placed the link to the specific formulation I use in the pinned comment below so you can review the composition and see if it aligns with your needs. When we ignore this localized tissue degradation, we aren't just accepting a less satisfying physical life. We are ignoring a critical biomarker of our overall vascular health. The delicate blood vessels in the erectile tissue are often the first to show signs of endothelial dysfunction. What manifests as a performance issue today is frequently a precursor to more significant cardiovascular challenges down the line. The correlation between sustained physical vitality and overall quality of life as men enter their 60s and 70s is profound. It's not simply about intimacy. It's about the psychological resilience and confidence that comes from knowing your body functions optimally. In my practice, the men who actively address these localized vascular issues don't just report better performance. They demonstrate a sharper cognitive focus and a more aggressive, positive approach to aging in general. This is something the clinical trials often miss: the undeniable link between physical confidence and systemic well-being. To summarize, the decline in performance you might be experiencing is likely not just low testosterone, but a localized degradation of the endothelial tissue and smooth muscle caused by oxidative stress. By utilizing targeted, concentrated interventions that address the specific damage, we can restore the tissue's natural ability to function, rather than just relying on temporary pharmaceutical fixes. Tell me in the comments, have you ever suspected that your issues were more about localized blood flow than just your hormone levels? The biological window to reverse this localized tissue damage is not indefinite. Your vascular system has plasticity, meaning it can heal and respond to intervention, but that capacity for cellular repair diminishes as the oxidative stress compounds over the years. The specific nutritional support I discussed is designed to integrate into a broader protocol of health, providing the concentrated, localized intervention that basic habits alone often cannot achieve once the damage has set in. The information and the link are in the pinned comment for your review. The difference between men who maintain their vitality into their later years and those who accept decline is almost always the speed at which they act on the subtle warning signs their bodies give them.